We are rocking and rolling on this Tuesday. It's April 16th, 2024. Enjoy this fabulous day today. As I said earlier, very special guest in the studio. First time at WDIA and the Bev Johnson Show. I am excited, y'all, to talk to her because I have never had a guest on my show who was a cardiologist. And we're going to find out. We're going to welcome in Dr. Jayna Kelly to the Bev Johnson Show. Good afternoon to you, Dr. Kelly. How are you?
Good afternoon. I'm doing very well. I'm blessed to be here.
Hey, we're both blessed to be here,
Say
sister.
that for the people in the back.
I know that's right. But before we get started, Dr. Kelly, tell our listeners a little bit about Dr. Jayna Kelly.
I will gladly do so. I am a born and raised Memphian.
Oh, really?
Yeah. See, you're another one. I get to.
I didn't think so.
It's one of those running bets I always do with my patients, and then I usually win because, of course, they're like, "Oh, from the Northeast or whatever." No,
Exactly.
Born and raised Memphian, and blessed to be back home as of June. Just to give a brief rundown of my circle.
Please.
I graduated from Ole Miss with a BS in biology. Got a master's at Indiana University in Indianapolis, and then came back home for medical school and did 4 years of medical school at UT. And initially started out in general surgery and did 2 years of that residency. So a lot of people don't understand the path of medicine and the sacrifice that a lot of us take for doing this. And, you know, you got your 4 years of undergrad, 4 years of medical school, and, of course, I threw in a master's degree. And then your residency, or which is your training, quote unquote, junior doctor, is at least 3 years.
Wow.
General surgery is 5, but I only did 2 of the 5 years there because I decided I wanted to shift gears and pivot, that's a big theme for a lot of people. And so I pivoted, and God put me into internal medicine. And so I did 3 years of internal medicine residency, and then another 3 years of general cardiology fellowship down in New Orleans at Ochsner Clinic Foundation. And then some reason he said, you need to go be cold for a year, and sent me up to the University of Vermont, all the way in Burlington.
What?
90 miles from Montreal, and finished an interventional cardiology fellowship. And so I just got back home June of 2023, and it's been nothing but amazing to be home and know that I'm 10 minutes away from family and friends and support. And back home taking care of people that I always committed to taking care of. You ask anybody, they'll tell you she was always coming home. Mm-hmm. It was always the plan. I just had to take a lot of detours to get there. So
wow.
I'm glad to be back.
I love that story. So I have to ask you, because you're a native Memphian?
Yes, ma'am.
What high school? You know I was going to ask you, because you know these folks were going to be listening and saying
college is irrelevant. Anything else beyond high school, it's every generation. Every generation.
It is.
I started out at White Station. I did 9th and 10th grade there, played basketball, and I ended up transferring to Briarcrest and finishing out high school there. So I had a mix of bags. But I started at John P. Freeman, so all my Panthers, you know me.
Yeah,
I'm back home.
They know you. Wow, that is great. I was just thinking, Dr. Kelly, I didn't know, have they add on years for people who go into medical school, or it depends on what you want to go into?
Is it in terms of the training?
Yes.
Yeah, so it depends on what you want to go into. So internal medicine, most residencies, the minimum is 3 years. And so you'll have 3 years of that. But then if you decide to specialize, say out of that medicine, and you say you want to be a cardiologist like me, that was another 3 years. Or you want to do rheumatology, which is anti-inflammatory, a lot of those diseases. I think that one's 2 years. And then there's endocrinologist, which is another 2 years. So it varies. It definitely varies in terms of the specialty. And I thought it was crazy that you need 3 years for cardiology. But now that I'm into it, I'm like, I respect it.
Okay. For our listener, well, before I ask you that question, why did you decide to go be a cardiologist?
It wasn't exactly my decision. It was God's decision.
I hear you.
As you can see, I'm pretty straightforward and direct and have plans in play. But when he throws you curveballs and pivots, you kind of sometimes have to listen, even if you have to go kicking and screaming, but he'll guide you in the right path.
You're right.
And I always thought I was going to be a surgeon, but a lot of things shifted and forced me in this path. And I when I tell you I pretty much stumbled into cardiology, I kind of did. But it was a burning desire that I didn't know I had. And it makes sense to me. There's more than enough need here in this community.
Yes.
And there's not many people that do what I do that look like me.
Yes,
So
you're right.
It's
When you were working, was it hard? Well, working during the pandemic, did you? I know the medical field. It was crazy.
It was crazy, and there was a lot of mixed emotions because on one end you're saying, hey, yes, this is what I signed up for, but nope, nobody put a pandemic when I signed the Hippocratic Oath in med school and things like that. And it's also something in a modernized country you don't expect to happen, or world for that matter.
Right.
So this is something none of us could fathom. But there was a pivot moment too. You had to rally and figure out the best way to serve the people that you were taking care of while keeping yourself safe. Burnout, we're all human, absolutely occurred. I think there was a little resentment that a lot of doctors had, and I luckily emotionally I was pretty healthy and checked in with myself and figured some things out, but a lot of people didn't have that opportunity. And so I'm grateful to a lot of the support staff that we had that helped make our jobs a little bit easier. The nurses, the cleaning staff, all of that above. People don't give them enough shout outs.
Yes.
And, those were the same people who reminded me that, hey, you can do this. And they had no idea who I was. But they'll just be like, I see you, Doc.
Yeah.
I got you. And that was one of the great parts about training in Memphis because you did get that a lot, especially from our people. So,
Yes. I love that. So, Dr. Kelly, what is a cardiologist?
Ooh, the question of the day.
Question of the day, sister.
Question of the day. In some ways, for what I do, I'm a glorified plumber. But we'll
like
get that path. But a lot of us will call it, for the interventional part that I do, and that's actually procedure side of it. So we'll break it down in two paths. And the first path will be, we'll talk about what a general cardiologist is.
Okay.
They're also known as non-invasive in the fancy medical world. But a general cardiologist essentially is the one you see when you say, hey, I've got chest pain, I've got these issues, I feel like I need to go see somebody. A lot of times that may be what they are, but a lot of us also cross over between interventional and general. And a general cardiologist, they check things from cholesterol, hypertension, arrhythmias or abnormal rhythms of the heart. A lot of people are like, oh, I got a murmur. They're like, you might need to see a cardiologist. They'll send you for that as well. And what a lot of people don't know about cardiology, it actually is a form of preventative care. And especially, again, in our community, we're in southern United States, and a lot of people are fighting genetics in combination with their environment. And so a lot of people just don't know that. And I think that's one of the biggest points that I want to make is that don't wait until something happens to come see us. The other side of it is interventional cardiology. It sounds fancy, but that's the plumbing side of things.
Okay.
And essentially what that is saving lives through pricks in the wrist or in the groin. And we use catheters and wires to go up and either open up blockages. People hear about blockages or the widowmaker and things like that. That's what we do there. But there's also other realms of interventional cardiology that include, pacemakers if you have a bad rhythm and you need help that way, or you have a valve that's abnormal or something of that sort that needs further intervention or replacement. And everything doesn't have to be surgical anymore. So
It doesn't.
It does not. Not all of them. Of course, that's a gray area and patient dependent, but you have options. So those are the two major branches of cardiology and a cardiologist.
Okay. And basically, Dr. Kelly, someone would come to you if they're thinking that something is going on with their heart.
Pretty much that. But the catch is with that, there's so many other things that tie into the heart.
Okay.
Such as high blood pressure.
Yeah.
High cholesterol, diabetes. Those are all over obesity even. A lot of people don't realize they have sleep apnea, and that ties into your health of your heart as well. So those are things that we all cover and encompass cardiology, essentially.
When you think about, dealing with your heart, and people have other diseases, that's why when doctors tell you to make sure you check your blood pressure, make sure that you're eating right, you don't get overweight, because that can put, as we would hear all the time, strain on your heart.
Strain and stress on your heart, absolutely. Stress in the literal senses causes stress on your heart?
Yeah, because I was going to ask you about, because I know people who, well, have friends just let folks stress them out and
there's actually a disease called stress-induced cardiomyopathy, which is basically where the heart has a surge. The thought is that it's a surge of hormones, but usually it's the broken heart syndrome that some people have heard about.
Yes.
So that's what we call it. The scientific term is stress-induced cardiomyopathy, but usually they have a grave change of events. Somebody dies or something dramatic happens, and it's so bad to them that the surge of hormones and things cause the heart to basically kind of give out a little bit to a certain extent. So, but yes, that is, all those things cause stress, as well as stress itself causes stress.
Okay. You mentioned, and I'm curious, a pacemaker, and I've always wanted to know, why would a person need a pacemaker? I had an aunt who had a pacemaker, and now one of my best friends has a pacemaker, and I always tell her, you letting folks stress you out, but tell her, why would you need a pacemaker? Well, Dr. Kelly.
Absolutely. And pacemakers are very common.
Okay.
And there's nothing wrong with getting one. If somebody needs one and they deem that it's appropriate management for you, it's okay. But a pacemaker essentially helps to regulate the rhythm of your heart. And so sometimes people, either it's age, either they've had a heart attack that's caused some injury to the heart, to the electrical system of the heart. It prevents the heart from giving the regular signals sometimes, or the signals are abnormal for you getting the proper signals through the top and the bottom of the heart. And so what a pacemaker tends to do is to help regulate that. Or if you have an abnormal rhythm such as atrial fibrillation, sometimes you'll have treatment for that atrial fibrillation, which is called an ablation. Mm-hmm. But when they do that, it basically knocks out the regular part of the regular electrical system in which a pacemaker may be required.
So why is the rhythm, I'm hoping I'm asking good questions. Why is the rhythm important for your heart?
Well, the rhythm is what helps keeps the blood flowing in terms of the pumping and everything. It sends the signal, hey, that's your turn to pump.
Okay.
So you have, just to back it up to basic anatomy with the heart, you've got 4 chambers. It's not I love the regular heart signal, but
okay.
Your heart is a little more complex than the one we make with our fingers. But you can still see, even with this, that you have essentially 4 chambers of the heart. And so you have what we call atria, or the top part of the heart, and then you have ventricles, which are the bottom or the more muscular part of the heart. And so you've got to make sure that the signals are getting from the top to the bottom, because it syncs up the rhythm. It's basically sending signals to sync up to give you the proper time to pump out the blood to the rest of your body.
Mm-hmm. So that pacemaker keeps it at a steady pace?
It can, or sometimes it's for backup. If somebody has an abnormal rhythm, but it's not always in that abnormal rhythm, it can sometimes present as, okay, it reads the rhythm and says, hey, that's not right, time to kick in. And then it'll back off if it gets it back into regular rhythm.
So who usually, Dr. Kelly, would need a pace? Well, not me, you just told me, but I'm thinking the age group. You have to be, people think you're old to get a pacemaker.
That is not true.
Okay.
There's some people who have some congenital disorders, or people who were born with abnormal issues with their heart may need one for various reasons. So you could easily be a teenager and require one, or you could be in your 20s, or you could be in your 70s. It just all depends on what the diagnosis is and the indication.
So it doesn't matter?
No.
It doesn't matter.
It's not just you're just old, you get a pacemaker.
Right.
No.
Right.
That would be too easy.
That's too easy.
Yes, ma'am.
I love that. I love that. And so when we're talking about, thank you for explaining the pacemaker.
Absolutely.
So when we have heart attacks, what is that? What is the attack?
The attack is basically, it's heart attack.
Yeah, right. I know.
But basically, you have major arteries that supply blood to the heart.
Okay.
And so what happens in a heart attack is an area is not getting blood flow. So when that area doesn't get blood flow, the heart is like, oh my God, like I need that because blood gives you oxygen and the nutrients and things that you need for your muscles. And remember, the heart is a muscle. So it's a lot of people forget that, but the heart is a muscular organ. So it needs that blood flow and oxygen and removing things because it's similar to like your bicep or anything.
Okay.
And you can have lactic acid and all these things. So blood flow and exchanging of getting nutrients in and getting rid of toxins and things of that sort are important in that. So when you have a blockage, we call it blockage all the time because that's the most generalized way to explain it. But basically, you have a hole and the blood's not getting through it. And so over time, if it continues that way, that tissue can start to die off because it's not getting any oxygen. So that's why it's really important if you have chest pain, don't ignore it. You'd rather somebody tell you that, no, you're good, it was fine, it may have been just gas.
Right.
Versus sitting there and waiting and potentially dying. Okay. And I know that's very dramatic, but we see it too often because either people are hesitant, especially in the African American community. We're hesitant with doctors over our history, we know. But also just being very stubborn and worried about bills and things like that. And it's like, well, you can't pay the bills if you're not alive anyway.
Right.
So that's irrelevant to it. So with it being live tissue, time is important. So you have chest pain. This feels like something you've never had before. And go get it checked out. That's what doctors work. This is what we do every day. This is what we're supposed to be doing is making sure that you're safe, you're healthy, and you're happy.
So, Dr. Kelly, how do you know if you're having a heart attack or if it's just gas? Let me tell you what happened to me the other day.
Do tell.
Okay. Well, the other morning, so I got up to go to the bathroom, and then the left side in my back showed up. I'm like, what is this? And I'm kind of thinking like, is that hard? But it was like it was hurting, and so I was doing this, so I went on. But then it eased off, and I'm thinking, was that gas? I know, y'all, she's looking at me crazy.
I'm like, I mean.
No, she's not looking at me crazy. She's looking like, what? What? So I was wondering, I'm thinking, and I just thought, I said, it was back here, I said, that's probably gas. Mm-hmm. Because I ate something later or something, and I'm thinking, but it went away, Dr. Kelly.
Okay.
It did. It went, and nothing else that day.
Yeah. So when we're talking about
gas or if you're having a heart attack.
Gas, heart attack, and I don't want everybody to think every pain they get in their chest is a heart attack, but I also don't want you to think everything that you get in your chest is not. Okay. If that makes sense. And what our job is basically to put the pieces of the puzzle together. Okay. And what I mean by that is looking at associated symptoms. Did you have shortness of breath? Did you have some dizziness? Were you sweating? Did you get really nauseous? Mm-hmm. Did you throw up? Did you pass out? Did you feel your heart fluttering? I mean, there's so many questions that we ask. We're detectives to a certain extent to help sift through all the gray area and figure out, okay, yes, this might have been a heart attack. And then on top of it, we collect data. So we collect an EKG, which most people know what those are, but that's looking at your rhythm. And on the EKG, we usually can see, hey, yes, you had a heart attack. No, you didn't, but you do have some abnormalities with the rhythm, or you may have had a heart attack a long time ago or something like that. And so there might be some tissue damage. We also collect labs, and we look at the proteins of a protein that the heart gives up that tells us if you're actively potentially having a heart attack as well. Mm-hmm. But the main thing, though, for us is putting the constellation of symptoms and signs. And I think one of the most important things that I'm here to tell is that a lot of us assume we're supposed to have just chest pain. Yeah. And you got to understand that the research and the data historically was not done on us, and it was not done on women. And so I emphasize this because it's like, yeah, men kind of know what they're feeling and things like that. But even so, all of it doesn't fit in the same box in terms of men and women. And so I've seen women who have just strictly had nausea and vomiting. Mm-hmm. I've seen men who have had strictly nausea and vomiting. I've seen women who've just been like, I'm dizzy. I just feel my heart fluttering, blah, 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 blah. The chest pain radiating to the left arm, that's kind of the classic presentation, but everybody's not going to present that way. And you also got to think about what your risk factors are. And that includes obesity, high blood pressure, diabetes, high cholesterol, a premature family history, which means that you had a first-degree relative that was in their 50s that had a heart attack or even passed away from one, and weight, things, all of those things. You look at that and collect and say, hey, you know what? Maybe I need to go get this checked out. This pain isn't something I normally feel. Or this burning. Some people describe it as an elephant on their chest, but that's not always the case.
Okay.
So it's a myriad of presentations. But in my training, that's what I'm supposed to do, is be the detective and figure out, A, if it was, B, if it wasn't, what it might be, and guide you in the best direction I can.
Okay. Good information.
Okay.
So you you did answer my question, but I'm still asking. You think it was the gas?
See, I would have to see you in the
Kelly,
office.
I know.
And we have to go through some HIPAA-related stuff, and I can't do that on the radio.
That's right, and you're right. I respect that.
But it more than likely, might have been, if you said it was right after you kind of ate. Did you eat some spicy stuff? These are things that I ask my patients all the time.
Yes.
And the main thing is, if you think about what I just told you, you say, hey, do I need to maybe go see somebody and just make sure? Or even go into the thing is, you can even start with just your primary care doctor just to get an EKG and say, hey, do you see anything crazy on there? Getting your blood work done. And, again, it's preventative care is the most important part.
I like it.
It's like taking your car in for its 35,000-mile checkup. Well, you don't think you need checkups too?
Yeah.
We got this one body. At least the car gets new tires, new parts, and things like that pretty frequently. But we don't get to change things out very often, especially in your core organs. So
you're right. Thank you for saying that. If you've just tuned in this afternoon, I am talking with Dr. Jayna Kelly, cardiologist. Okay, y'all, this is your turn to talk. If you have a question for Dr. Kelly, we invite you to call now, 833-535-9342, 833-535-9342 will get you in to us. You're listening to WDIA.
Here's Bev Johnson.
And I'm talking with cardiologist Dr. Jayna Kelly. Dr. Kelly, we're going to our phone lines to talk with Joanne. Hi, Joanne.
Hello, I have a question for the doctor.
Go right ahead.
I would like to know, how do you know if you need to go to a cardiologist or a vascular doctor, or are they the same thing?
That's a good question. Nice to meet you. It depends on what the issue is, and there's some crossover. So say that somebody's having some leg pain, or they have wounds on their legs, diabetic wounds, things of that sort. We both can kind of manage those issues. If it's dealing specifically with your heart, then you typically want to see a cardiologist first.
Okay.
Thank you.
Okay.
You have another question?
Thank you.
All right. Thank you,
No,
Jo.
ma'am. Thank you.
You're welcome. Thank you, Joanne.
Thank you.
Hi, Zola.
Hi.
Hi. Your
I would
question.
How would someone become a patient of yours?
That is best question of the day. You win the award. So just to give a little backstory, if you got a few minutes. So I have a partner, Dr. Dan Dishman, and he and I started a practice called Metropolitan Cardiovascular Institute. We're at 1975 Nankana Boulevard, and our number is 901-337-1625, and we'd be more than happy to see you.
All right. That's it. Thank you.
And before she goes, Zola, we'll give her number out again.
Okay. All right. Thank you.
Bye-bye. WDIA. Hi, caller. Hi, you on the air?
Hey, Bev.
Yes.
Can you hear me?
I hear you now, loud and clear.
Hey, Bev, this is Sorod out here in California. How you doing?
Hey, sister, is this my Sherry?
This is your Sherry, baby.
Hey, Sherry Bell, I love you. You know I love you, Sherry.
And I love you more. Bev, this is such an important topic that you got today.
Thank you, Sherry.
I don't have a question, but I have a comment there.
Okay.
Thank you to all the doctors, cardiologists, and all that who work in this field. They are some very, very special people.
Well, we really appreciate that.
Yes, 2019, when I first went into cardiac arrest.
Wow.
Okay. Didn't know I was this serious. My heart was in this type of shape. Went into cardiac arrest, flatlined twice.
Wow.
Thank God I'm still here to tell about it, because the doctors had given me up and said she's not going to make it through the night.
Mm-hmm.
And here this is 2024, and as of 2023, I got sick again, but this time I noticed my breathing was getting very short.
Mm-hmm. Mm-hmm.
And my regular cardiologist said, I'm sending you to Cedars-Sinai. They can do far more for you than I can because of the type of hospital it is and the technology they have.
Mm-hmm.
They sent me to the hospital. I was there for 3 months.
Wow.
End up with what they call the LVAD. I have an LVAD now.
I'm very familiar with that. You're a living, breathing testament right now.
Yes, I am. I made it. I'm living with the LVAD, waiting for a heart transplant.
That's fantastic.
Oh, Sherry.
Yes. Here's the good part.
Okay.
6 months after I got out the hospital, my brother who was taking care of me got sick. We had to rush him he went to being military, went to several different hospitals. Then I called my sister-in-law and said, we got to get him to Cedar. Got him there. They kept him for 3 months. He had to have a heart transplant.
Wow.
He's been out. He got out right before Thanksgiving of last year. He's still recovering. I'm doing well.
Good.
I'm still recovering, but still waiting for my heart. He was far more critical than I was, and we didn't know it.
Mm-hmm. Mm-hmm.
We had no clue. But thanks be to God, I'm still here. Don't stop praying for me. You doctors are hand-working miracles through God, and I can truly appreciate any and every cardiologist I have ever come in contact with, and the ones that I know are truly doing their job. Thank you so much for this show, Bill.
You're welcome, Sherry. And you know I love you, and I'm so glad to hear from you. Dr. Kelly, this is my line sister as well.
I see.
I love you, Sherry. And
love you too, Bev. And you know I'm always listening every chance that I get. And you know this is the first time I've ever called in on the show, period.
Well, thank you.
I normally just text
Yeah.
Your story needs to be told.
Well,
your story needs to be told.
Yeah, thank you for telling that, Sherry. And you take care of yourself, and I love you, and be safe, sister.
I will. We'll talk later.
We will. Bye-bye.
Thanks, lady.
Good
Bye-bye.
luck. Good
Bye-bye.
luck to you.
Dr. Kelly, now that's a testament, huh?
That is a testament. What she experienced, it sounds like she went into what we call cardiogenic shock, and that's when the body starts to shut down as a result of the heart not working very well. And so when she's talking about, she threw out some technical terms there.
Right.
So I was like,
Yeah.
don't worry, I got you guys. I'm going to save you. And so what I think they may have is some type of familial related cardiomyopathy or abnormality of the heart that's causing them to go into what we call heart failure. Mm-hmm. And with heart failure, a severe form of that can transition into cardiogenic shock. And that's what it sounds like she had happen, and probably had she had basically a round of sudden cardiac death, it sounds like, with an abnormal rhythm that probably caused that as well. And I bet you she has an ICD, which is in the family of pacemakers, but we'll talk about that later.
Okay.
But what she meant by an LVAD, it's man, you've got it. You can never discount science and the people who love it. And I really appreciate the people who do, because people have been working for years to create a device that's able to basically pretend to be the left side of the heart. So the left side of the heart, or the left ventricle, is the very most muscular portion, and where most of the arteries kind of supply blood. but it's the part that does the big pumping out to the heart, to the rest of the body. And so what she had is what we call a bridge to transplant. And what a bridge to transplant is giving her time so that she can still have a decent quality of life while she waits to get a transplant. Unfortunately, with transplants, that whole situation is another complex discussion. But you kind of have to be just sick enough to be on the list, but well enough to tolerate the transplant.
Okay.
And so it sounds like that's where she is, but her brother was in a place where he needed it he was not going to tolerate the bridge to transplant, which is the device, the LVAD. And so basically that is functioning as the left side of her heart and allowing her to still live life and do things such as call in. And she sounds fantastic. I hope she is. But
yeah, she does.
I mean, that's the stuff I saw in New Orleans a lot in my training. And I'm grateful that I got those opportunities because it allows me to recognize when people need higher levels of care and hopefully catch it sooner rather than later so that we don't get that far and get them on transplant lists or get them to the right specialist sooner rather than later. So
I love that. Thank you, Sherry. She's in California.
That's fantastic. Good luck.
WDIA. Hi, caller.
Hi, Bab.
Hi.
Okay, I'm 62, and I just been having problems in my leg, right? But I got rheumatoid arthritis, and my doctor was telling me that I got just the arthritis pain, but my dad stopped walking in his 70s, and now my mom done stopped walking, but they telling me that this is rheumatoid arthritis, but I'm having sharp pains on top of my feet and by my calf leg. So I wanted to know what she think about that.
Well, I'm glad you called in. You're in the right place. Just like you can have a heart attack or blockages and plaque buildup, and we kind of didn't go into a full detail of that, but those same things can happen in your leg arteries. You have arteries throughout your body, and so they see the same blood and the same nutrients and as well as waste and toxins that you see in the rest of your body. One of the things that you can have is blockages in your big arteries that supply blood to your legs. And when those start becoming blocked, it can cause you to have numbness. It can cause your legs to feel super heavy when you walk, bad pain. You can get wounds that may not heal very well, and you'll have skin discoloration. But we take care of that also as cardiologists. So I definitely don't think it's unreasonable for you to see a cardiologist and get some workup with ultrasound of your legs to look at the blood flow of your arteries. And we look at the veins as well, make sure you don't have any blood clots. But the most important thing is the arteries, looking and making sure that you have good enough blood flow that that's not the cause of the issues that you're having.
Okay, yeah, I had an ultrasound about a month ago. They just did them down at the bottom, right below my feet, and she said she didn't see anything.
Okay.
So.
Okay. Well, but I don't know if it was so you have your arteries and your veins. And
yes, ma'am.
I don't know if you specifically had an arterial ultrasound or if you had a venous ultrasound. And so those are kind of two different road paths. But we look at both of those. So that's totally appropriate to see a cardiologist for that and have that evaluated.
Yes, ma'am.
Thank you for your call. And again, before we leave, and Dr. Kelly will give out her information, Unforgetful.
Great show, Bev Johnson. How you doing, Dr. Kelly?
I'm well, sir. How are you?
Hey, I just want to ask you a question dealing with the advancement in medical science. Are you keeping up with that?
For the most part. I mean, it depends on how far we're going, how advanced you want to go.
Do you know anything about what they were talking about, the glove that help veterans dealing with the stroke?
With the who? I'm sorry?
Glove.
What Unforgetful?
Yeah. It's a glove that veterans can have.
A glove dealing with strokes?
Yeah, like a glove. It's really some kind of a device that they put on a veteran's like on their hand, to help with their stroke.
You're talking about as a rehab device, basically, to try to increase the strength and things like that for you if you have like a defect or you lost some movement in your arm or your leg. Is that what you're talking about?
Yes, ma'am.
Okay. That's not my area of expertise. I don't do a lot of rehab research.
I understand, but I want to move on to something else.
Okay, what's your next question?
I wonder about this things dealing with cancer. Do you know anything about cancer, Dr. Taylor? Anything?
I know a little bit. It's one of those things I haven't had to know a ton about lately because I've been focused on the heart. But
Yeah, she focuses on the heart, Unforgetful, not cancer. She's a cardiologist focusing on the heart. Do you have a question about the heart? No?
Yes, ma'am. I have a
or
lot
blood
of questions.
circulation.
Okay, well, okay, but think about it, but she focuses on the heart. Thank you, Unforgetful. Thank you, Unforgetful. Dr. Kelly, I have some emails for you, and this email said, but you explained this, but please ask Dr. Kelly what, again, is AFib?
Absolutely. And, there's so many topics we can cover. We could spend a whole day here. We could spend a whole day talking about, but I'm glad you asked that. And, one of the catches of being a physician and the practice of medicine is being able to take the scientific medication and knowledge that we have and break it down and make sure that our patients in the community understand it to the point where they can figure out what's best needed for them. So thank you for asking that. AFib is the short term, basically the medical lingo for atrial fibrillation. And that is an irregular heartbeat. It's the most common arrhythmia that people have next to what we call sinus tachycardia or a fast heartbeat. And this the reason it's so important is because as you get older, it does increase your risk for atrial fibrillation. And the most important concern for it is that it's one of the causes of people having strokes at times. And so if you do have that, it is important that you do follow up with a cardiologist, preferably. I'm a little biased, but I know that we'll get you in the best care with atrial fibrillation and making sure that you're on blood thinners if indicated, if you need further medical management of that arrhythmia. So that's essentially what it is.
All right. Dr. Kelly, you're popular today. Next email says, ask Dr. Kelly. This person says, I'm having swelling and cramping in my feet. I'm also having swelling in my ankles. What can I take to do for this? I've been on, and I hope I pronounced this right. This says, I guess she says furosemide, which is Lasix. It's a water pill. You got it. And other meds, but it's not helping. I've also been to a vascular. They did not find anything. What type of doctor do I need to see?
You're talking to her. And I'm not saying that just because,
no.
But there's many reasons that people can have swelling. It could be you have your veins that aren't working very well. It could be your heart, and it's a symptom of heart failure. And common things being common, that's something I would certainly rule out before I just say, okay, I'm just going to take medicine and try to treat the symptom. So if you have not had a cardiac workup, I think it's reasonable to do that, or at least pay us a visit. Or a cardiologist.
Give your number again.
Again, our number is 901-337-1625, and that's Metropolitan Cardiovascular Institute.
Sounds good. Next email, Dr. Kelly says, Dr. Kelly, does your practice accept United Healthcare insurance as in the network?
I'm 99% sure we do. I know there's all these subcategories of insurance, and I don't want to make any promises, but if you call our office, they'll be happy to check it for you. And if we do, I'm happy to see you.
And our next email says, Dr. Kelly, could you address how important it is that you also have a primary doctor, internal med, who can get through the EKG chest gray, who can refer you to see a cardiologist or any specialist if they see a problem, and how important is it to have a complete physical once a year? Thank you, Mary.
She is preaching to the choir. A lot of times people come to see us and we're the first doctor, the first person they've seen. I'm technically a specialist in the sense that, yes, I'm happy to try to address some other things, but I should not be your one and only doctor.
Yeah.
Like I said, we have this one body. We have cars that go and get checkups. You have to absolutely get checkups. The beauty is that usually they're pretty quick when you're doing okay. If you take care of yourself and you keep these things regulated, you're keeping track of a lot of the potential issues, or you're able to catch them early enough. The problem is a lot of times people wait till something has manifested to the outside of their bodies, And usually when that's happening, things have gotten more severe or more complex than you would like, and all of us would like. So going to I have a primary care doctor. I go get physicals, and I work out 5 days a week and really try to watch what I eat. I'm fine replacing knees. I just don't want a new heart. So I can't stress this enough. We invest in everything else in the world. Why not invest in yourself? So yes, please. Thank you for that.
And this other email from Glenn, Dr. Kelly, how important is it to exercise so you can keep your heart strong?
It's very important, and it doesn't take a lot. I think people see exercise and they assume they have to run a half marathon or, you've got to go be an Olympic swimmer, and that's not it. I mean, if you dance for 30 minutes a day, if you walk around your office. I was talking to a patient not too long ago, and she was like, I can't get out. During your lunch break, put a podcast on, put some music on, put this show on for that matter, and go for a good walk. And now this isn't a walk where you can hold a full conversation and talk to somebody or whatever on the phone, build up to that, but you want to push yourself a little bit so that you're at a moderate amount of activity. And that is like a brisk walk. So that's faster than your regular pace, but you don't necessarily have to be running and, dying of sweat and short of breath. And what we emphasize is 150 minutes a week, or that's basically 30 minutes 5 times a day. And there's no, I say this, I know somebody's going to be like, I have this. You have no excuse. There's always something you can do to exercise. If it's walking, if it's getting a stationary bike, if it's just climbing the stairs in your house, you don't have to spend money to exercise.
Yeah. I try to do that. I told Dr. Kelly I'm not an exercise person, but I do walk up and down my steps upstairs. I'll do that.
But setting a goal, say, hey, this week I'm going to try to make sure I do it 5 times a week and go up and down the stairs, 3 times in a row, and giving your 30-minute window and saying, hey, I've checked that box.
Yeah. You have given us some good information, Dr. Kelly. This is so, I have enjoyed this. Before you go, I want to go back to one of the things you said. And should you be cautious, especially if you've had a family member who's had a heart attack?
Great point. A lot of people don't realize it, but there are some genetic components to cardiovascular disease. And, one of our red flags, I guess, to say if somebody said, hey, I had a patient, said her mom passed away at 39. Well, I'm like, oh, my God. And she knows for a fact that it was from her heart. So that's my radar is screaming like, okay, we gotta get you in the loop, make sure we're following up on things, because the last thing you want to do is miss something on a patient just because you say, hey, they don't fit the bill, or you're not old, or you're young, you're too young to be here. There's no age, there's no set limit, there's no rule or reason that you have to qualify beyond you have a heart. And if you feel like there's something that's going on with it, come see us.
I like that.
All right.
And again, give our listeners your information.
One more time, we are Metropolitan Cardiovascular Institute. We're 1975 Nankana Boulevard, which we're right over near the airport. And our number is 901-337-1625.
This has been fabulous today.
Well, I'm glad.
I look forward to you coming back and giving us more information.
Absolutely. We can pick some topics within cardiology and kind of talk about those, whether it be more rhythm stuff or heart failure, high blood pressure. We need to talk about all of that.
We need to talk about all of that, Dr. Kelly.
Absolutely.
Especially with our folks. But I'm so glad to see Dr. Kelly. She is a black woman, a young black woman up in here.
Hey, I'm older than I look now.
Well, you're not as old as I am, but
no,
that's
ma'am.
okay. But that's
no,
okay.
Ma'am.
But she's here, and I, what I like about you, Dr. Kelly, I see now. You probably tell your patients, you give them the word. Hey,
I do.
You don't be trying to cover up. No, I can see you gonna get on them.
You become family when you come to visit us, but when you come family, you're not getting any shoulder rubs, massages.
Right.
I'm gonna tell you like it is, because me sugarcoating is not going to help you do any better.
It isn't. Yes.
And you're spending your time and your money to come see us. So
yes,
that's what you're here for. But my goal is always, and I stress this all the time, is to give you the information and the data and give you the options to make the best decision for yourself. I can take you to the water, but I cannot make you drink it.
I know that's right. Thank you, sister. I'll say our new cardiologist,
Yes,
Dr.
ma'am.
Jayna Kelly, is here. Thank you, Dr. Kelly, for being
Very
here.
welcome.
And I
glad to be
appreciate
here.
you. Hope to see you again.
Absolutely. You can come see me too.
All right. To see if make sure it's not gas. Huh?
Yes, ma'am. Yes, ma'am.
All right.
I hope it is just
I
gas.
hope it is just gas too. Thank you, callers. Thank you, listeners, for joining us this day on the Bev Johnson Show. We really do appreciate you. So until tomorrow, please be safe. Keep a cool head, y'all, and don't let anyone steal your joy. Until tomorrow, I'm Bev Johnson, and y'all keep the faith.